Okay.
Chris, if you want, if you need a screen share, you should be able, there you go.
Okay.
Okay.
All right. Well, welcome Christina Crain, who's the Executive Director of the Stamford Senior Center. And Christina really doesn't need any introduction. She's been with us now for, this is the 4th presentation, I believe.
Probably.
On the updates to Medicare. And you're on, Christina. Go ahead. Welcome.
Thank you. Good morning. It's great to be here. I, of course, wish I was there in person with all of you, but it's nice to see. I hope everyone's staying healthy. So I'm happy to give you an update on Medicare, talk a little bit about the changes, and just kind of review what we do every year as far as what your options are, since we are in the middle of the annual election period. So, okay. So we're going to cover a little bit of some new benefits under Medicare, what the premiums are going to look like for 2021. We'll recap some information on the Medigap or Medicare supplement plans. We'll talk about what Part D options are available, as well as Medicare Advantage, and then just mention the Medicare Savings Program, because every year I think there's 1 or 2 people that approach me afterwards that think they're eligible for this. And it's such a great program and kind of a secret in Connecticut. So it's important that I mention. Okay, so just to recap very quickly, there are 4 parts of Medicare. We're going to touch upon each of them today. Part A is your hospital insurance. It covers anything when you're inpatient in a hospital, as well as some limited skilled nursing home care under strict guidelines. And that's one of the parts of original Medicare, Part A. The other part of original Medicare is Part B, which we call medical insurance. That covers you for outpatient stuff, all of your doctor's visits, diagnostic tests, anything done on an outpatient basis, including outpatient surgeries, physical therapy, all of that stuff. And then Part C is also known as Medicare Advantage. This is an alternative to traditional Medicare. So you can opt to have traditional Medicare Parts A and B, and then pick up a supplement plan and a Part D drug plan. Or you can choose to go the Medicare C route, which is buying a Medicare Advantage plan and having all of your Medicare benefits administered under that one particular plan. And Part D is the prescription drug benefit. So also sold by private insurance carriers, and it just covers prescription drugs. So some new things coming in 2021. First is something called the Senior Savings Model. This is a new benefit in some Medicare Advantage and Part D plans, which will offer lower out-of-pocket costs for insulin if you enroll in one of these Medicare Senior Savings Models. So it would cap insulin copays at $35 a month. Now that doesn't apply to all insulin. So it depends on the carrier you choose and what insulin they're covering. And the one thing I'm going to mention about this, so if someone is diabetic and on insulin, definitely want to look at these plans. But I will tell you, I've been doing some plan comparisons for folks. And I've seen plans that are not part of the senior savings model that have lower copays for some insulin. So even though this is a new option, and of course we should explore it if someone's on insulin, don't take the mentality that, oh my God, I need to get one of these 8 senior savings models because I'm on insulin. You may find a plan that doesn't have the senior savings model that has lower copays for insulin, but that really depends on the insulin that you're taking. Medicare Advantage plans will now be open to people with end-stage renal disease. Historically, if you had end-stage renal disease, you could not buy a Medicare Advantage plan. You had to stay with traditional Medicare. But for the first time, those plans are being made available to people with ESRD. Acupuncture, this is something that's not traditionally covered by Medicare, but Medicare will cover up to 12 visits in a 90-day period for chronic lower back pain. So this is really, I highlighted, underlined this because it's really important. It's not going to cover acupuncture for other conditions. So if you have inflammatory or infectious disease, pain resulting from surgery, those will not trigger coverage for acupuncture. It has to be for lower back, chronic lower back pain that doesn't have an underlying origin. So I'm going to make these slides available. I will send them out to distribute to all of you afterwards. And I've put a clickable link here because if you click on it, it's going to give you more information if you want for how you can get some acupuncture covered. But it is, kind of strict guidelines for that. Sorry, I screwed up. Okay. And then the other new thing is limited telehealth. We are, 9 months going into 9 months into COVID. So a lot of us, have probably experienced telehealth appointments at some point in the past 9 months with our medical providers. So telehealth will be covered for end-stage renal disease visits, for home dialysis, services for diagnostic evaluation and treatment of an acute stroke, and services to treat substance abuse disorder. There is a great app on our phone. A lot of us have smartphones, Apple or Android smartphones. And I don't know if any of you know this, but it's called the Medicare What's Covered mobile application. And you could download it in the App Store. You can also just get this information on Medicare.gov. But if you want to see if a test is covered, how often things like colonoscopies are covered, you download this app and you just type in whatever you want to see if it's covered and hit go, and it's going to tell you if Medicare covers it, how often it covers it. So for example, here I put in coronavirus antibody test and it tells you that Medicare does cover the antibody test. It's covered Part D. So this is a great app, I just think, that you may want to download on your phone. It is free and it's kind of can be useful just to see if something's going to be covered ahead of time. All right, so let's go into the premiums and what they look like for 2021. So Medicare Part A, as we said, is your hospital insurance. Medicare A is premium free for most people that are on Medicare. As long as you have accumulated at least 40 quarters of work in your lifetime, which is equivalent to 10 years, you are not going to pay for Part A at the time you get onto Medicare because you've been paying for it through your payroll taxes while you were working. There are people that don't meet the 40 quarters of work. And so if you're between 30 and 39 quarters of work history, you can buy into Medicare. It would be $263 a month for people with under 40 quarters of work, but over 30. And then for people with less than 30 quarters of work, the monthly premium jumps to $478. So it is pretty costly to purchase Medicare Part A if you don't have the 40 quarters of work. The hospital deductible. So if you have just Medicare A and B, and let's say you don't have any supplement coverage, there is a deductible under Part A. It's called the hospital deductible, and it's projected to go up to $1,452. And this is a per benefit period deductible. And I know we talk about this every year. It's very different than, it's not an annual deductible. So you could potentially pay the deductible a few times throughout the year if you're hospitalized, sporadically throughout a calendar year. So a benefit period is 60 days where you're not receiving any skilled care. So let's say you went into the hospital on January 1st. Again, you only have Medicare A and B and no supplement coverage. You would have to pay the first $1,452 of your hospital bill. After that, your hospitalization is covered at 100%. Now, let's say you leave the hospital on January 10th. Okay. And you're doing great. You're home. Everything's going well. If you re-enter the hospital within 60 days of the day you left, you're in the same benefit period. So you would not have to pay that hospital deductible again. But if you re-entered the hospital, let's say on March 1st, now more than 60 days have gone by, you would be in a new benefit period. So you would have to pay that deductible all over again. So that could, be costly for someone that has, multiple hospitalizations through the course of the year. Supplement insurance, of course, you can get to cover that. Like I said, once you pay your hospital deductible, you're covered for 100% for your inpatient hospital stay from day 1 to day 60. If you have more than 60 consecutive days in the hospital, then you would have a daily copay of $363 a day from day 61 to day 90. If you exceed 90 days in the hospital, you have these 60 lifetime reserve days, but that's not going to apply to most people having that much of a significant hospital stay. Again, a Medicare supplement policy would pick up all of these, the deductible and the daily copay for your hospitalization. Skilled facility care. So first we'll start by saying, again, Medicare only covers skilled nursing facility care if it's preceded by a 3-day inpatient hospital stay. And Medicare will cover the first 20 days in a skilled nursing facility in full. But then you have a daily copay of $181.50 from day 21 to day 100. Okay. And Medicare pays nothing after your 100th day in a skilled nursing facility. Okay, Part B. So we said Part B is basically what covers your doctors and any kind of outpatient care you receive. Part B, the premium, there is a premium that everyone pays for Part B. It is expected to go up a few dollars. So the Part B premium is tied to the COLA, the cost of living adjustment in Social Security benefits. And when your COLA goes up, when Uncle Sam gives you a little increase in your Social Security check, Medicare premium goes up. So they give it to you with the left hand and they take part of it with the right hand. So the Social Security beneficiaries will receive a 1.3% cost of living adjustment in their Social Security checks in 2021. That amounts to about $20 a month increase in your Social Security check for the average beneficiary. The Part B premium is expected to increase by $3.90. So it's going to go up from $144.60 a month to $148.50. Now, this is a pretty accurate estimate, but these have not been confirmed by CMS yet. They usually release those numbers actually this week, usually the first week in November they come out. They haven't released them yet. But from all indications, we're looking at about a $4 increase in your Part B standard premium. The Part B annual deductible, and this is an annual deductible, you only pay it once a year, and it's currently $198, and it may increase by a few dollars, but again, they have not released those figures as of yet. Now, after you meet your annual Part B deductible of $198, any services that you receive that are covered under Medicare Part B have a 20% coinsurance. So again, assuming you only have Medicare A and B and no supplement coverage, you would pay 20% of the cost of your doctor's bill, an MRI, a CAT scan, chemotherapy, radiation, anything like that. So there are some big out-of-pocket costs in Medicare if you don't have some additional coverage to pick up those costs. The IRMA is the income related adjustment for higher income earners. They implemented that a few years back, where higher income earners are going to pay an additional premium for their Medicare Part B. And in 2021, so they've started adjusting that income level for inflation. So in 2021, if you're single and your adjusted gross income from 2019 was over $1,111, you're going to pay a surcharge of 1.4. So you'll take your standard premium and multiply it times 1.4 to get what your adjusted premium will be. And then it goes up from there. So again, this is for higher income earners earning over $111,000 a year if they're single, or married couples earning over $222,000. I put this slide in because I think it's important to have. You know, some of you may be assessed the IRMA surcharge for your premium. Again, they're going back 2 years of looking at your income tax return from 2 years ago. So if your income was higher 2 years ago because you were still working or your spouse was still working, but now you've retired, your spouse is retired, or any of these other life-changing events happen, a death of a spouse, a marriage, a divorce, work reduction, work stoppage, you can ask for an appeal. You can file an appeal so that they look at your current year's income as opposed to the income from 2 years ago. And there is a form you have to fill out. It's called the SSA 44 form. I have put the link, so when you get these slides, the link will take you right to the form. And you can file for an appeal for them to reassess based on your current income. Again, if you've had one of these major life-changing events. So we talked about the gaps that Medicare and B don't cover, the deductibles, the 20% co-insurance under Part B. So one of the things you can do is buy a supplement policy, what's called Medigap insurance, to pick up those deductibles and co-insurance amounts. And Medigap is sold by private insurance carriers, and they supplement the traditional Medicare Parts A and B. In Connecticut, we are very fortunate to live in a continuous enrollment state. So that means you can enroll or you can change your Medigap plan anytime throughout the year. A lot of other states do not allow that. So, you know, we're in annual election period right now. In a lot of other states, you have to make your Medigap choice right now, and then you'd have to stay with that plan for the whole year. That's not the case in Connecticut. So if anyone has a Medigap plan, I think you definitely should look at it and say, hey, am I in the best plan? Is there a plan out there that's cheaper? And we'll talk about that in a minute. But the nice thing is in Connecticut, you're not under the gun to change plans right now, and you're not locked into the plan for the year. Medigap insurance is regulated at the state level by the Connecticut Department of Insurance. So that's different than the Medicare Advantage or the Part D plans, which are federally regulated by the Centers for Medicare and Medicaid Services. And Medigap plans sold after 2006, when the prescription drug benefit came into existence, they do not include prescription drug coverage. Now, there were plans prior to 2006 that had some drug benefit, very old plans, J. Someone may still have one of those plans, but today, you cannot buy a Medigap plan with prescription coverage. So if you have traditional Medicare and sign up for a Medicare supplement to pick up the copays and deductibles under Medicare, you would still need to purchase a Part D drug plan to cover your prescription drug costs. Unless you're a veteran and you're getting your drugs through the VA. Okay, if you're a veteran and you're getting your medications through the VA, you may opt not to get a Part D plan because you probably don't need it. With Medicare supplement insurance, there are no networks. So you can go to any doctor, any medical provider, any hospital that accepts Medicare. And you can go anywhere across the United States. So it is a very portable plan. You're not locked into networks. It's good anywhere you go in the country. And that's, you know, a nice thing, nice flexibility. So this rate sheet I pass out every year when I'm there. I'm happy to send it out to anyone that wants it. It's also on our website, so you can get the most up-to-date form on our website. And I realized the, the writing on this is pretty small, but I'm gonna just highlight a few things on this. So this is the rate sheet that's put out by the Choices program. It's updated every time a carrier adjusts their rate. This one just came out in October. Actually, this says revised 7/14, so I forgot to put the one that just came out. I didn't update it, but I'll have it for you, and it is on our website. So all the way to the left is all the names of the companies that sell Medicare supplement insurance, and the plans are standardized. So they're alphabetized, letters A through letter N. So what that means is that as long as you're comparing the same letter plan across carriers, the benefits are identical. So if you're looking at a plan G, whether you go with Anthem Blue Cross or you go with USAA, the benefits under that plan G are identical, okay? What changes is the premiums. So if you look at a plan G, Anthem Blue Cross has a plan G at $201.57 a month. And then Colonial Penn, the third one from the top here, has that same exact plan for $551.59 a month. So identical coverage, premiums drastically different. So you really should look and say, hey, is there a better plan for me? If you're getting the same exact coverage, why on earth would you pay $550 when you can get it for $201? And actually with United Healthcare, you can get it for $198, the one at the bottom. So this is a very useful rate sheet. You should look at it, and you should definitely make sure, is there a cheaper plan out there that's going to give me the same benefits? What I want to touch upon now is over here, you see 3 columns that are in orange, right? And those are for plans C, F, and high deductible F. Those plans cannot be purchased by anyone that's new to Medicare as of January 1st of 2020. So if you were new to Medicare as of this past January or going forward, those plans are not available for you to purchase. Anybody that had Medicare prior to January 1st of 2020 can still purchase one of these plans. So even if you weren't in a plan before January 1st of 2020, you can still purchase it, okay? It's just not, those are not available for new Medicare beneficiaries. Now, Plan F historically has been the most comprehensive plan you can buy, okay? So a lot of people would go to a Plan F. What I want to tell you is the only difference between Plan F and Plan G is that Plan G does not cover the Part B annual deductible of $198 a year, okay? Plan F does cover that. But so let's look at Plan F. So Plan F right now, there's not that many carriers that are even offering Plan F anymore. Oh, actually, I'm sorry, I was looking at high deductible F. Plan F here. Every carrier is still offering it. Again, if you had Medicare prior to January. But a Plan F, the cheapest Plan F you can buy today is with United Healthcare, and it's $259 a month, okay? You can go to Plan G with United Healthcare for $198 a month. So you're saving $60 a month in your premium, right? Again, the only thing you're getting with F, you're not getting with G, is that Part B deductible coverage. So you're saving $6 a month in premiums. So do the math there. What's that come out to? It's like $700, right? So let's say now you go with a Plan G, you're going to have to pay the Part B deductible of $198. Okay, so you're saving $720 in premiums, but you pay that Part B deductible through the course of the year. You're still saving $522 a year in premiums with a Plan G over a Plan F. And that's with the United Healthcare example that I gave you. But same thing if you go to Anthem. Anthem's Plan F is $85 more a month than their Plan G. So you're saving even more there. So I point that out because there are a lot of people that have had Plan F because it has been the most comprehensive plan. But now you could really save quite a bit of money by going to a Plan G as the Plan F premiums keep creeping up. So if we go, and then I'll talk a little bit about, you'll see there's a high deductible Plan G and a high deductible Plan F. What do those mean? So the high deductible plans basically mean that you would have to pay the annual deductible, which is $2,340, before the plan started covering you at 100%. Okay, so someone that's healthy but doesn't want to dish out $200 a month in premiums, they could opt to go to a Plan G, high deductible Plan G for $50 a month, and save quite a bit of money because again, you're still going to have traditional Medicare, which is going to cover, other than the hospital deductible, you would have to pay that first. If you were in the high deductible Plan G or Plan F, you would pay the hospital deductible because you have to meet that $2,340 annual deductible before the plan kicks in. But if you're healthy, you're not hospitalized throughout the course of the year, a high deductible plan can save you money. So just something to keep in mind. And again, you could be in one plan now, you could change plans next month. So you're not locked into the plan for the year. So you definitely have flexibility. Okay, so I think I covered everything here on the Plan CF high deductible F. Again, they are available to anyone that's had Medicare or Medicare eligible prior to January 1st of 2020. All right, so let's move on to Part D. That is the prescription drug benefit. So Part D plans can charge an annual drug deductible. And depending on the plan you sign up with, it could be anywhere from $0 up to $445 in an annual deductible. So there's like 27 drug plans to choose from. You'll see their deductibles are anywhere from $0, it could be 150, it could be 300, it could be as high as $445. And, you know, even though the donut hole has been eliminated, it was eliminated last year under the Affordable Care Act, you still have these benefit levels. So after you meet your deductible, you enter the initial coverage limit where you're paying about 25% copay, coinsurance for your drugs until your total formulary drug costs reach $4,130. Okay, in 2020, your total formulary cost had to reach 4,020. It's gone up to 4,130 for 2021. Once your total formulary drug cost, that includes what you're paying and what the plan is paying. Once they reach $4,130, you enter what used to be called the donut hole or the coverage gap. But again, the donut hole is gone. So you just go back to paying, you're still paying 25% for your brand name drugs, 25% for your generic drugs. Okay. And you stay in that level where you're paying roughly 25% of your drug costs until you reach a total out-of-pocket threshold of $6,550. Now, a lot of people are never going to reach that out-of-pocket threshold in the course of the year, especially if you're taking generic medications. But some people with high prescription costs will reach that. When your total out-of-pocket costs reach $6,550, you enter the catastrophic coverage. And that's when the plan starts paying the bulk of your drug costs. So you'd be paying $3.70 for a generic or preferred drug that has a retail price under $74, or 5% of drug costs for drugs that have a retail price greater than $74. And for a brand name medication, you'd be paying a $9.20 copay for drugs with retail prices under $184, or 5% for drugs with retail price of over $184. So I know this is kind of a confusing slide because there's just a lot of data on there. But again, the majority of folks are going to stay in this, this area here where they're just paying roughly 25% of their total drug costs. And again, these are for formulary drugs. So you definitely want to get a plan that covers your drugs. As I said, there are 27 Part D plans to choose from in Connecticut in 2021. The lowest cost plan is going to be SilverScript's Smart RX plan at only $7.20 a month. And the most expensive plan is a Blue Medicare Premier plan coming in at $135 a month. And again, this is just prescription coverage. So the premiums for the other 25 plans fall somewhere in between those two. A lot of them are in the $35, $40 price range. As I said earlier, there are 8 plans offering the $35 or less insulin coverage. That's the Senior Smart Savings model. And if you have SilverScript is now being managed by Aetna. So you probably have already gotten a letter in the mail saying that your plan is now switched over to Aetna. And if you had Envision RX, the Envision RX plan is now called the Elixir plan. So anyone that has Envision or SilverScript should have already been notified of those changes. So again, what do you want to consider when you're looking to choose a drug plan and you want to see, should I stay with the plan I have? Should I switch plans? You really want to look at, again, what plan is going to give you the best coverage and it's going to cover all of your drugs ideally. There are fewer and fewer plans that cover all of your drugs these days. So you want to find a plan that's going to cover most of your medications and the most expensive of your medications, right? And you want to look at which pharmacy you like to go to because there is cost savings depending on the plan you're in and the pharmacy you use. So there's something called preferred network pharmacy versus a just plain network pharmacy. So when we do a plan comparison for someone, we always ask them, what are your pharmacies of choice? Because we're going to look to find you a plan that you can get the lowest cost based on the pharmacy you like to use. let me explain the sign, then I'll just say kind of my side thing. So this is just interesting because we are seeing cost sharing going up for people across plans. So, you know, for like a preferred brand name drug, your average cost sharing is about $40, anywhere from $24 to $47 a month in cost sharing. So the drug price cost sharing is definitely going up in Medicare Part D plans. And we've been seeing a steady increase over the past few years. So like they like to say they're keeping their premiums pretty level, but they're passing more of the cost of the drug on to you as the beneficiary. So, you know, what I want to say is a lot of people, they don't want to go through this process every year and they'll just stay with the plan they have. Now, unlike Medicare supplement plans where you can change your plan anytime throughout the year, with Medicare Part D, you cannot. The time to change is between now and December 7th, and you're locked into the plan for all of 2021. And I've done about a dozen plan comparisons right now for Medicare beneficiaries. And I can safely say, I think all but one, we found significant cost savings for them to change plans. Only one person, it was worthwhile to stay in the plan they had. Other people, I saw savings of anywhere from $500 to $2,000 a year in savings switching to another plan. So even if you think your plan is good this year, it doesn't mean it's going to continue to cover your medications next year. And how much is the cost sharing going up? You know, if you look at that previous slide again, the cost sharing can be going up significantly from 34% to 50% for non-preferred drugs. So you really should, whether you do it yourself through Medicare.gov or you have one of the great volunteer counselors we have help you do it, you definitely should evaluate your drug coverage before December 7th. There's something else that I'm sure a lot of you know about. There are these discount cards that are out there. I put up the GoodRx one. I know there are others out there. I can't think of the name of them right now. But GoodRx, again, they have an app. You could download it right on your phone. And it's very easy if you go to goodrx.com and you can look up any medication and it'll tell you where, you know, what you can get it for using their coupon code. So I put this here and I mentioned this to you because you're going to find some plans that just simply, there's no Part D plans that cover certain medications. Tribenzor comes to mind right now. Tribenzor is a combination drug for high blood pressure. And for some reason, none of the Part D plans cover it. So I put that in and you can get a significant savings, 60% savings with GoodRx. You know, so if you have a drug that we can't find any Part D plan that covers it, definitely should look at GoodRx. You can download the app on your phone, or you can just go online on your computer and print out the coupon code and you bring it to your pharmacist and you get the discount. And even if a drug is covered under your Part D plan, you may find it cheaper using the GoodRx discount code than what the Part D plan is charging you for a coinsurance amount. So definitely good to look at, you know, if you're seeing a high drug cost. And you have a right to do that. You can go to the pharmacist and say, don't put this drug through my Part D plan. I'd rather just use the GoodRx coupon code and get a bigger savings. I put this in here, but we don't have what the amounts are going to look like. As there is an adjusted income related premium for higher income earners for Part B, it also applies to your Part D premium. So again, if you're in the higher income brackets, you're going to pay a little surcharge on your Part B premium. And we don't have what those figures are going to look like for 2021. But I did leave the slide in there just to make you aware if you're in those higher income categories. And the adjustment on your Part D premium is not going to be charged by your plan. It's going to be deducted from your Social Security check. Social Security takes that surcharge premium. Okay, let's talk about Medicare Advantage now. As I said in the very beginning, Medicare Advantage is the alternative to traditional Medicare. And all of your Medicare coverage is administered under that Medicare Advantage plan. So you have your Part B benefit, your Part A hospital, your Part B outpatient, some extra benefits like dental, vision, hearing aids. There's some limited coverage that are offered by Medicare Advantage plans that you don't get in traditional Medicare. And most Medicare Advantage plans include the Part D drug benefit. So in 2020, well, we'll talk about that in a minute. Most Medicare Advantage plans are HMO plans. So that means you have to go to their network providers. And if you go out of network, you have 100% of the out-of-pocket costs. There are some PPO plans, we call preferred provider plans. Those plans you can go out of network. You have a higher cost sharing than going to a network provider, but at least you have the flexibility of going out of network if you needed to. And most Medicare Advantage plans do include the drug benefit. So you can't buy a Medicare Advantage plan and a separate Part D plan, okay? That's not allowed. If you have a Medicare Advantage plan, it includes the drug benefit. There are, I think, 2 or 3 Medicare Advantage plans that don't include the drug benefit. Those are specifically for people, for veterans that are getting their drugs through the VA, okay? But if you're not a veteran, you're not getting your drugs through the VA, you want to make, and you want a Medicare Advantage plan, you want to make sure you're signing up for the Medicare Advantage plan that has the drug benefit. And again, most of them do. So in 2021, there's going to be 29 Medicare Advantage plans to choose from in Fairfield County. The carriers are Anthem, Aetna, Connecticut, United Healthcare, and WellCare. There's also some special need plans for people on Medicaid and people in a long-term care facility. We're not really going to touch upon those. The premiums for Medicare Advantage plans range anywhere from $0 a month to $241 a month. And those are in addition to the Part B premium. So that Part B premium of $144.60 or $148.50 it's going up to will still be deducted from your Social Security check. Now, I'm sure you're seeing a lot of commercials. There are several plans that have a 0 monthly premium. There are, a lot of commercials on TV right now about those plans. They do exist, but the general rule of thumb is if you're buying a 0 premium plan, you're going to have higher out-of-pocket costs at the point you need care. So you're going to have higher co-insurance amounts, okay? With Medicare Advantage plans, there is a maximum out-of-pocket threshold that you as the beneficiary would pay in a calendar year. So it's going up, the maximum in-network out-of-pocket threshold was $6,700. It's going up to $7,550 in 2021. Now, some plans have a lower maximum out-of-pocket, but that's the most your out-of-pocket can be for in-network care. I stress in-network because if you go out of network, the sky's the limit if you're in an HMO plan. So it's $7,550 for in-network care. If you're in a PPO plan, your maximum out-of-network ceiling for out-of-pocket cost is going to be $11,300. Okay. And again, if you go out of network in an HMO, there is no ceiling. You're paying 100% of the bill. Sky's the limit. As I said, several of these Medicare Advantage plans are offering limited dental, vision, and hearing benefits. So they are attractive to many folks. There's about 40% of the Medicare population is on a Medicare Advantage plan because you can get a 0 premium plan and you do get these added benefits. And as long as you're healthy, they can be good plans for you. This slide was interesting. This is through the Kaiser Family Foundation, and it's a great website. There are so many choices for Medicare beneficiaries. And if we look at 2021, there are 57. The average number of options seniors have is 57 plans to choose from between Part D plans and Medicare Advantage plans. And we are right there in Connecticut. There are 57 choices. So there's so much to choose. How do you compare 57 plans? And the Medicare.gov website definitely helps you do that. And we'll run through that in a little bit. So the Medicare Savings Program. This is a state program administered by the Department of Social Services that would help lower income Medicare beneficiaries by paying your Part B premium each month. So if you qualify for this, that $148 that comes out of your Social Security check each month for Part B would be paid for by the state, and you would get that money in your Social Security check each month. And the income limits to qualify for this program are $2,617.40 individual monthly income limits, or 3,000, and somehow I have an extra 3 and an extra comma in there, so I apologize. It's 3,535 a month for a married couple. And this is gross income. It's gross income, but there is some exclusion. If you're still working, it does exclude 50% of your earned income. So if you have some earned income and you're over those income amounts, you may still qualify. There is no asset test for the program. So it doesn't matter what you have in savings, stocks, bonds. They don't look at that. They look at the income. So your income includes Social Security, pension, dividends, interest, rental income. So any income is included, but not your assets. And the application is on this website. It's also on the Stamford Senior Center's website. And it's a really easy application to fill out. And there's no income verification that you have to submit. It's all what you put down on the application. Now, they will verify your income with Social Security, of course. So I just went over a lot of plan choices, a lot of options, 57 options for Medicare beneficiaries this year. How do you compare? How do you know where you should be if you're in the good plan, if there's a better plan for you? So Medicare.gov has a very good tool. It's Medicare.gov site. And what I encourage everyone to do, if you haven't already done so, is to create a MyMedicare.gov account. It's very easy to do. And it's a great way to compare plans, because when you create a MyMedicare.gov account, it's going to pull up all of the drugs you filled in the past year. It's going to show you your claims history. So there's a lot of good information on there for you. So you go to Medicare.gov. You can either preview Medicare drug plans and Medicare Advantage plans by just clicking on Preview Health and Drug Plans, or you can go over here and either log in if you have an account already, or hit Create an Account. And it's very easy to create an account. You're going to click on Create Account up here where I circled it. If you already have an account, you're going to type in your username and your password. Now, if you don't have an account and you want to create one, all you're going to need is your Medicare card, because you will need your Medicare number. And other than that, it's pretty much all the information you know: name, email, date of birth. And then you will need to select a username, a security question in case you forgot your username or password and need to reset it, and a password. And then it'll tell you once you've successfully created an account, and it'll ask you to use your username and password that you just created to sign in. So this is someone that has a MyMedicare.gov account. And this is what once you sign in, it's going to tell you, well, this is your current plan. So this person has the WellCare prescription plan. It tells you when their Part A and Part B coverage went into effect. And we can just click Preview Plans, and it's going to tell them exactly what plan they have right now. This person, Pamela, has the Silver Script plan, and she's getting the low-income extra help for that plan. So it's really good to create an account, because like I said, instead of you having to manually enter all of your medications, the plan is going to do that. The plan finder is going to do that for you. It's going to populate all your medications and save you a lot of time. So then it'll just say, okay, these are the medications you've been on this past year. Are they the same? You can change here. You can remove the drug if you're no longer taking it. You can change the drug quantity or the dosage, and you can add more drugs if there are more drugs you're taking. And once you do that, you hit done, and then it's going to ask you to select pharmacies. Now, this is new this year, that you can now select up to 5 pharmacies to compare prices. In the past, you could only select 2 pharmacies. So now you could select up to 5 pharmacies. You put in your pharmacies. Once you choose them, they'll pop up down here: CVS, Rite Aid. And then you hit done, and it will take you now to the plan comparison. So it tells us we have 27 plans to choose from. I don't know if you could see this on my screen. Let's see. Okay, so over to the right, there's a little box that says insulin savings. If you check that, it's going to show you plans, only the insulin savings plans. Okay, even if you don't check that, the insulin saving plans will still come up. So you don't need to check it. So you can also sort, what happened here? Okay, you can also sort plans by the insurance carrier if you wanted to. If you're specifically looking for Aetna or for Anthem, you can sort by insurance carrier, and you can sort by star rating, how highly rated the plans are. I don't recommend you next. I mean, you can do that if you want to, but the default sort is lowest annual cost, which includes your premium and your drug costs. So that's the default sort. So that lowest cost plans are going to come up first. So you're going to list the plans are going to show up, right? You can choose up to 3 plans to compare. You just click on the plan. It'll pop up down here saying, you know, here's the one plan you're choosing, WellCare. You select 2 more plans and you click compare, and it's going to give you a side-by-side comparison. So we chose WellCare, Express Scripts, and Mutual of Omaha. And it will show us down here what our estimated cost is. So first it shows us the premiums up here. Now this person is getting the low income subsidy, so they have lower premiums because of the subsidy. And then down here, it's going to show us, okay, the WellCare plan is going to charge this person $13,000 a year at Rite Aid. Same at CVS. Okay, there's not a difference between pharmacy. But then if we go over here, the Express Scripts is going to cost them $5,887 a year. And then the Mutual of Omaha, $6,204. So you can see the prices vary greatly. So this WellCare plan that Pamela's in this year is definitely not the plan for her to stay in next year, because her costs are $13,000, you know. So the Express Scripts is the most beneficial plan for her. And there's a print button here on the top right. You can print this and it'll, you know, print out the plan comparison for you. You can also click on the blue box for any plan, and it's going to give you the plan details. It's going to show you what the copay is for each drug, what drug is covered, what drug is not covered, and all the information you want. So to recap again, the annual enrollment periods, it started October 15th, it ends December 7th. That is the last day you can make a change to your Part D or Medicare Advantage coverage. And your benefits do not change, the coverage does not begin until January 1st of 2021. This slide, actually I changed, but so ignore that slide, because I'm gonna give you a number at the end, the local slide at the end of where to call locally. So something to keep in mind, there is a Medicare Advantage, they call it the enrollment period. That is a period from January 1st to March 31st, that if you are in a Medicare Advantage plan and you decide you don't like it, you have that window up until March 31st that you can switch to another Medicare Advantage plan, or you can leave Medicare Advantage plan altogether and return to traditional Medicare and join a Medicare drug plan between January 1st and March 31st. What you cannot do during that Medicare Advantage enrollment period is you cannot go from original Medicare to a Medicare Advantage plan. And you cannot join a Part D plan if you're already in original Medicare. You need to do that now before December 7th. And you cannot switch from one Part D plan to another. That also needs to be done now, between now and December 7th. So that Medicare disadvantage period, I had a client last year. She was in a Medicare Advantage plan. She was in it for years, very healthy. She got diagnosed with a rare cancer and needed to see a specialist at Sloan Kettering. And the doctor and the hospital were out of network in her Medicare Advantage plan. Thankfully, it was in early March, so she was in that Medicare Advantage enrollment period, and she had time to get out of that Medicare Advantage plan, go back to traditional Medicare, and buy a supplement policy, which allowed her to go see that doctor and surgeon at Sloan Kettering. But had it been outside, you know, after March 31st, she would have been locked into that plan. So her options would have been see the specialist and pay 100% out of pocket, or go to another doctor that's in the network. So friendly reminder, COVID tests are covered by Medicare Part B with no copay. The COVID antibody tests are also covered by Medicare Part B. Yes, we don't have a COVID vaccine yet, but we have the flu vaccine. So really important this year to get your flu vaccine if you have not already gotten it. It's not going to protect you from COVID, but it is going to help protect you from the flu. And the last thing you want is to have the flu and get COVID on top of that. So that's just my little spiel for you. So if you need help comparing plans, you can go to our website and you're going to click on the more menu item at the top menu bar and then click on important use. And there it will give you a downloadable form to complete where we're going to ask you to put your name and list your medications. And you will then email that form to us and we will assign you a counselor that's going to call you up and set up an individual appointment to do the plan finder search with you either through Zoom or through the phone. We're not doing in-person appointments this year due to COVID, but the Zoom one-on-ones have been working really well. So that's it from me. Now I can see everyone. I will open it up to questions. And I know, go ahead.
Thank you, Christina. And I see a few people have their hands up already. Go to the participant list and raise your hand to speak, and I will call you in the order. And as always, one question at a time. And then if you want another question, just raise your hand again. And one thing, a very subtle thing with the Advantage plans, when my wife was admitted to nursing care, they asked if she was on a supplemental or Advantage. Any treatment that they have to provide, if you're on an Advantage plan, has to go and be approved prior to them doing any treatment. And it sometimes could be a crapshoot whether they approve the treatment or not. But if you're on a supplemental, it's as long as a doctor or the prescriber says you need it, it gets covered. So it's a little subtlety there. And the other one is that the pharmacies now, if you ask them to get you the least expensive price, you don't have to do that through GoodRx on yourself. They are allowed to find you the best price. And they found a prescription that the plan covered for $75 copay. They found one and gave it to me for $37. So, all right, Stu, your hand is up first. Go ahead.
Thanks, Chris. As usual, great discussion, great presentation. The slide that you had that showed all the Plan B, I think you said it was out of date because the United Healthcare plan that I have, the G plan, is currently $198.25. And I'm wondering, did they not increase their price this year, or we just have to wait for the newest slide?
Give me 1 second, Okay, the United Healthcare Plan G is 208.
208.
Up to 208.
Okay,
Yeah.
thank you.
Yeah.
Okay, Larry Berger. Larry, unmute yourself.
Do you hear me now?
Yep.
Okay, thank you for the presentation. It's always great to listen to it every year. The acupuncture benefit that they're adding on this year, is that also available on the Advantage plans?
Yes, it would be, because Medicare Advantage has to offer at least the same coverage, comparable coverage as traditional Medicare Part A and B. So yes, it would be. I don't know what if there's any copay with the Medicare Advantage plan. That depends on the Medicare Advantage plan.
But most of it would be, yeah.
Yeah, but they should offer the benefit.
And what is the benefit again, if you can go over
So
it?
it's I gotta go back to that slide here. Let's see. It's up to 12 visits in 90 days for chronic lower back pain. So it's chronic lower back pain is defined as lasting 12 weeks or longer having no known cause, so not related to cancer or inflammatory or infectious disease. And Medicare can cover an additional 8 sessions if you're showing improvement, and that's up to the doctor to document that you're showing improvement. If your chronic back pain is not getting any better, then Medicare cut out not to cover your treatment anymore. But it's not, they won't cover more than 20 acupuncture treatments in a year.
Okay, thank you.
Okay.
Okay, Carl Shapiro.
Hi, Chris. That was a great presentation. My question is, I'm kind of new to this process. If a couple is signed up for Medicare, but they're already covered by an employer plan, what kind of lead time should they give to eventually sign up for the D and B plans as well as a supplemental?
Okay, so if you're already on Medicare and you have an employer plan, is it through active employment or retirement benefits? Okay, and are you talking about if you're going to be retiring?
Yes.
Okay, so if you're going to be retiring, you have coverage right now. You can, you can evaluate. You have a window of, I think it's 63 days for Part D. So you can't be without coverage for more than 63 days. Of course, you don't want to be without coverage at all, right?
Right.
So I would say you want to really start looking 2 months prior to when your employer benefits are going to end.
Okay.
Okay. Because you really, although they give you a bit of a gap, like a window, you don't want to have any period of time that you don't have coverage. So you want to start looking and enrolling in your supplement plan and your Part D, and you're going to coordinate it. So let's say you're going to retire, I don't know, let's just say you're going to retire January 30th. If your benefits are ending January 30th, you want to make sure that you enroll in your Medicare supplement Part D in early January, because then your effective date would be February 1st, the first day of the following month.
So, and I know you mentioned that you have continuous enrollment for B, but you have just a window for D. But if you're just newly retired, you can just go into a D plan.
Right. You have within 63 days of losing other coverage.
Right.
Yes. When you will have what's called an initial enrollment period.
Okay, great.
Yeah.
Thank you very much.
Yep.
Bob Rosenthal.
Yes, thank you. Ms. Crain, I have for the last, I don't know, 8 years, been spending my Tuesday afternoons playing bridge in your place.
I know.
I want to know if it's ever going to happen again. Will that game ever restart?
Of course it is. I am an eternal optimist. It is going to happen. Yeah, there's some other senior centers that have active Zoom bridge games, and not sure how they're doing it, but Joan is not really very computer savvy, because I'd love to get a Zoom group going with bridge, but it will happen. I mean, we have to be hopeful. Bridge is tough, I'm not going to lie, because you really can't socially distance in a bridge game, and I think you're all handling some of the same cards and such. So that's going to be a tough game to come back in the world of COVID, but it will happen, Bob. Don't lose faith. It will. We'll figure out a way.
Larry. So,
Thank you, Christine, for a great presentation as always. Is the Shingrix shingles shot going to be covered by Medicare in 2021?
Yes, it's covered.
It's covered now, or
The shingles vaccine is covered. It's covered under Part D.
by Medicare? Oh, by the private insurance. Okay.
It's covered by, it's a Medicare benefit, but it's covered by your Part D, as in drug plan, not by Part B.
I got you.
Yeah. And I don't know why they did that. I don't know why, when all other vaccines are covered under the Part B, for some reason the shingle is covered through your drug plan, but it is covered.
And it's 100% coverage or just partial?
no.
No, there's a copay. And
Okay.
Yeah.
Yeah, some policies are $170 copay, But if you go through GoodRx, you can get it for 150. But if you use the copay from your plan, it goes towards your deductible. There's the difference there.
Right.
But one of the reasons that somebody mentioned to me was because Shingrix is not contagious
Oh, yeah.
as the flu or pneumonia and things like that. It's not covered, but I don't know. It was just
That
Yes,
makes
it-
sense, actually. That makes
Yeah.
sense.
Okay, Brian McDermott. Before Brian, Christina, you're going to send a copy of this to Steve,
I'll
if you
send it.
don't mind, and then Steve will email. I mean, even though this is recorded and everybody can go back and look at it, but
Yeah, it'll be easier for you to have the slides because there's some links on there that are direct links, which will be
yeah.
helpful.
So Steve, once you get it, if you can just send it like we've done every other year. Okay, I'm sorry, Brian, go ahead.
Hi, Christine. Thank you again very much for your presentation. Can you tell me, are there any Medicare, Medicare Advantage, Medicare plans? Is there any kind of coverage if you're out of the country?
Okay, so Medicare does not cover for out of the country care. Medicare Advantage definitely does not cover it. Okay, definitely not. There is a Medicare supplement plan. It's if you have Plan G or Plan F, they do have foreign travel emergency coverage, and it's a $250 deductible, and then the plan pays 80% up to $50,000. So that is the supplement Plan F or Plan G. I mean, there's a couple of other plans that cover it too. Actually, I shouldn't just say just Plan F or G. Plan N covers it too. The rate sheet that I'll send you, it'll be in the PowerPoint, but you know what, Steve? I will send you a PDF of the latest rate sheet too to send out. The back side of it tells you the plans that cover it. But yes, only through Medicare supplement, you can get some
Okay,
foreign.
great.
Thank you.
Ron Reckstein.
Christine, thank you again for a wonderful presentation. My question is, how can I get a copy of the current formulary for drugs?
So
Yes.
the formulary is different for every drug plan.
Oh,
So if you go to your drug plan's website directly, you can get they don't print formularies anymore. It's just too cost prohibitive and they become outdated. So you can get it online directly on your plan's website. But again, the easiest thing to do, honestly, is to really do a plan comparison on Medicare.gov. So you're looking at all 27 plans. But if
Right.
you just want your particular plan's formula, you got to go directly to their website.
thank you very much.
Dick Fisher.
No question.
Chris, you're a reason that everybody here should join the senior center. I apologize for the drilling outside the building. I have two comments. If you're going to get a shingles shot, call CVS because I believe there's no copay on the shingles shot there. Secondly, I want to point out an example for GoodRx, a good reason to go. I use Crestor cholesterol statin, and Express Scripts had me paying $64 copay. I went to GoodRx and Stop and Shop $16. So check with them.
Yeah, it's amazing how much cheaper you can get some drugs through GoodRx.
And there's another one that's RX. You can download too. And there's slight differences, and one may be less expensive than the other. Al Alaperty.
Hi, Christina. Thanks very much. I have a question on the IRMA appeal process. See if I have this right. The Part B premiums will be based on our 2019 tax return.
Right.
And we can appeal it to use our 2020 tax return, but we will have had to have filed that already, correct? Or at least filled it out.
Yeah, I don't know if you will need to have filed it already. I think you have to look, I've never actually done an appeal, Al, so I'm not 100% sure about that. I would check out the form, the online form, to request the appeal, and you'll see what documentation they're asking you for.
Yeah. Just to clarify, it's a rhetorical question. I have actually done the appeal twice already.
Okay,
And the way I do it is I just go into the Social Security office. This was pre-COVID.
yeah,
And you get a nice agent and he tells you exactly what to do. And I believe I gave him a copy of my latest tax return, and he plugged all the data in, and I got a reduction and a return.
Mhm.
But I did make that appeal almost in April, where I had already filled out my tax return. And
yeah. So if you already had the tax return, that helps. It's going to be difficult to go into Social Security.
Right, right.
Yeah,
it's different now, but
yeah,
but the appeal did work. It was
Good.
very cost effective for me because my income changed drastically from one year to the next.
yeah, for sure. That's good to hear.
Howie,
Thank you very much for the nice talk, Christina. Question, please. I have Form Plan J, which is no longer available.
Mhm.
Will that show if I go on to your the Medicare.gov and fill in that everything with, will it still be there for comparison? Or do they drop the records?
No, so Medicare.gov does not track what you have for supplemental coverage because it's not regulated by the federal government, by CMS. So they won't have your Plan J information in there. It's only going to show what Part D plan you're in.
Oh, okay, so I'm in the Part D plan of them, but so my medicines will show.
Correct. Yes,
Oh.
correct.
Thank you.
I'll just tell you there, I don't know what you're paying for Plan J right now, but you should look and see if, a Plan G can save you a lot of money, because there's not much you're getting in Plan J benefits right now that you can't get in G other than the Part B deductible.
Well,
But
what you showed me in the G and what I'm getting for next year, it's negligible.
okay, good. That's good. Okay,
Yeah.
that's good.
Thank you.
okay, Larry,
Right. Yeah. With regard to SilverScript, do they provide via email 90-day supplies?
yes.
Yeah, most of the drug plans, and you can select, when you're selecting your pharmacies, you can select mail order as an option. So you could see what the copays would be for the 90-day supply via mail order.
Yeah, because I was getting through Envision 90 days, and for the generics, a number of them were free.
Yeah.
But Envision, since it became Elixir, you had to do some paperwork because they increased the premium from $14 to $44 on on that same plan, and you had to opt into another plan to stay at $14. But
Yeah.
SilverScript, you say, is only $7 a month?
There is a SilverScript plan for only $7 a month, correct? Yep.
Okay.
But you want to just make sure, I mean, if you're taking all generic medications, you still should do a plan comparison across all plans. There are some plans, I'm trying to think, I think it was AARP, but don't quote me. There was one AARP plan that was giving 0 copays for generic drugs. And I think that premium was like, I don't know, $50 a month. And then they had a lower premium plan. No, I have it backwards. There was a lower premium plan that had 0 copays for generic drugs. And then the same carrier, AARP, had a higher premium plan called the Premier plan, which you would think would be better, but they were charging for their generic drugs. So sometimes there's no rhyme or reason, like why a carrier would have one of their plans give you 0 copays on generic and another plan that has a higher premium charge you a copay for generics. So really the plan comparison, I can't stress enough how important it is, because there's all these caveats that we don't even know about, and that don't really make a heck of a lot of sense, quite honestly. but the
Thank you,
savings.
Christine. My experience, I just checked with the AARP United Healthcare Plan for the 3 generics would cost me $39 a month, plus one of the generics was a $18 copay. Silver Scripts, $7.20 a month, and all of the 3 of them are zero cost.
See? Yeah.
So it's, you know, my wife, on the other hand, takes a multitude of drugs, even with the Silver Script, and between a Silver Script and a combination of Good RX, she would save about $300 a year. So between the 2 of us, it's only $700 savings. But just I've been using the high deductible plans, and my wife has met the deductible the last 2 years due to some serious problems. And the deductible amount was $2,340 last year. The difference in premiums were $2,300. So it cost me $40 additional. But the previous years, I saved like $1,500 a year. And on my case, with the high deductible last year, I saved almost $2,000 by going with the high deductible. And now with the G, if you use the between G's that I compared with my high F, the $198 difference was offset by the cost. So it's a toss up whether I go with F or G. So I'm going to stay with the F. But honestly, since 2013, I saved between my wife and myself over $15,000
With the high
deductible plans. And if you do need it, and you have to pay the deductible, the difference is you might end up paying the deductible in the first 6 months, as opposed to spreading it out over the year. But you know, if you don't use it, you're way ahead of the game.
Yeah, absolutely, Joe. And to Joe's point, you're not going to pay any more at the end of the year for a high deductible plan, even if you hit that deductible. So it definitely has the potential of saving you quite a bit of money. Just a matter of some people don't want to get a, you know, whopping $2,000 bill right at once, and they'd rather, yeah. So
The only whopping bill I got in both years was the $1,400 bill from the hospital.
Right.
But after that, I mean, most of them $6, $12, $22, and when you hit the deductible, you don't get any bills.
Yep.
So yeah, it's well worth it, especially if you're in any kind of decent health. You're definitely going to be, you know, 2 doctor visits a year, 3 doctor visits a year. You know, you're way ahead of the game.
Yep.
Well, again, Christina, you know, thank you so much. I think, you know, moving ahead, a lot of us will be able to, even if we, you know, have a better idea of which direction we're going in. And I was waiting to make my decisions after, you know, listening to you. And so
I will
again, I'm sorry to take you away from the mayor's state of the city.
Oh, that's okay.
Address,
That's all right.
but the city's in a sad state anyway.
I know. That would have just depressed me. I'd much rather spend my hour with you gentlemen. 2 quick things before I go. Next Tuesday, we are doing a veterans drive-through complimentary coffee and donut at the JCC. It's going to be from 9 to 10:30. So any veterans, please drive through. If you're available, get a free cup of coffee, get a nice donut from Lakeside Diner. If you haven't had one of their donuts, they're the best donuts in town. We'd love to see you. And last thing, again, if you, you know, aren't comfortable navigating the Medicare website, or you go on and it's just confusing, don't hesitate to reach out to us. And, you know, our Medicare counselors, I know you've probably, they're wonderful. They've been doing this for years. You'll either get me or one of them. They're all great. So we're here to help you sort it out. And again, December 7th is the deadline for Part D and Medicare Advantage. So Thank you. Stay well, everyone.
And you too, Chris. Thank you so much. Okay. With that, if anybody's got anything brief to bring up, other than that, Steve, give us 2 seconds. Nobody's showing a hand, so Steve?
Yep, I'm gonna close down the meeting. Everybody goodbye. I'll get that information out to you.
Stay healthy, stay well, and see you next week.
Aye.